The big issue in health systems in gender has to do with post-conflict reconstruction, because with the end of war we are having so many people attempting to rebuild the health system, and it's very important that they look at gender issues given the gendered impacts and the gendered nature of war and its effects.
There's going to be an increasing push towards universal health coverage. Critical to universal health coverage is close to community providers who are a critical interface between neglected rural communities and the health system. And we need to take a gender lens when we analyse and understand how to support, motivate, retain and empower that critical group, who are often female, although it varies across different contexts. But being embedded and part of the communities that they serve means that they have insights into how gender roles and relations play out within different households and different communities to affect vulnerability to ill health and ability to access services. And just to add on to what Sarah said, I think post-conflict in fragile contexts, close to community providers are really important. They've been really important, for example, in the response to Ebola. They'll be really important in terms of rebuilding trust between communities and health systems. And again, bringing a gender lens there will be critical to enable that group to realise their potential.
Community health workers are a really important component of the human resource group within health, but it's also really important to look at human resources as a whole in relation to gender and look at it with a gender lens, because just as community health workers tend to be predominantly female in many contexts, the gender distribution of the workforce is quite skewed overall, and you tend to have more males more at the top level positions, managers, doctors, whatnot, and it's women more at the lower tiers, nurses, community health workers, and it really does, impact upon the whole, general workforce. Often, women will have key needs and experiences and things that need to be addressed within the health workforce, a lot related to their family responsibilities. They often have a double burden, they go and they work within the health workforce, and they have to go work at home in healthcare, or childcare within the home. And it's very important that employment policies and guidance really recognizes this to support women and ensure that we can have a better, not so much of a skewed distribution of the workforce.
I think gender is something that's vital for health systems, and it needs to be seen in conjunction with other social determinants. So and a lot of our work in looking at specific contexts is really looking at gender along with class, education levels, rural, urban, caste, ethnicity, and looking at how that comes together as a mix to really change how social exclusion happens in the health system. And that's going to be different whether it's in Uganda, Vietnam, India, and we need sort of tailored approaches to, in each context, what the response will be. And I think those social determinants, for instance, it might be some of the biggest risk factors. Women have faced multiple barriers accessing health services, but there might be also risk factors that place men at particular risk as well. And if we look at the biggest drivers for some health behaviors in terms of alcoholism, the issues linked to war, violence, there are huge gendered behaviors that really put men in leading to higher morbidity and mortality in certain populations. So I think even though we're highlighting gender as a really important theme, we'd really like to break it down to be more effective and to really address problems in their own social context and look at how gender links to these other social determinants.
I think that's a really important point, Asha, and as we have taken forward in Rings, we've developed resources on intersectionality and looking at how gender interplays with other axes of vulnerability, as you said, disability, age, caste, religion, and we need to understand how that plays out in different contexts and make sure that health systems respond appropriately. And that's about capturing the right evidence, making that evidence accessible, and ensuring that it is acted on.
And another really important point that you picked up on is often when people think of gender, they think of women only, issues, or women-centered issues, sexual reproductive health, family planning. That's not the case. Gender affects everybody, and there are gendered behaviors that impact on our health, and gendered power relations that impact both women's and men's health, their behaviors, their health-seeking behaviors, their ability to access health care, and also thinking about how men are included in certain domains that are typically seen as female-dominated, like sexual reproductive and health and family planning, as major decision makers in many contexts. It's important to bring them on board and look at their role and see how can we work with both men and women to improve everybody's health.
Okay. And of course, when we normally talk about gender and health issues, as Rosemary has said, beyond just women, people tend to look, even within the category of women, they tend to focus on just issues to do with pregnancy, delivery, and immunization of children. And this, in a way, other than just leaving out the men, also leaves out women who are not engaging with the health system because they are either pregnant or they are having babies. So I think having a broader perspective on gender and health issues will help us to capture those women who, I can't say not in the childbearing age, they could be in the childbearing age, but across the life cycle. Someone may not be having a baby but still has issues of accessing treatment for malaria, accessing treatment for tuberculosis, accessing ARVs, and that's why when we talk about gender sensitivity in post-conflict health reconstruction, we are trying to provide services closer to the people other than just the physical infrastructure. How else do you make those services available and accessed by all, including women and children?
Rings, we have a very active, a bit on social media, and have quite a large social media platform. We have a website that you can visit. If you look, if you type into a search function, Rings and Resist, which is one of our cross-RPCs, cross-research project consortiums that we're involved with, Resist, Rebuild, and Future Health Systems. Our website is hosted within the Resist platform. You can also contact us through email at rings.rpc, that's rings.rpc@gmail.com. We have a very active Twitter account as well that you can reach us at. And our website contains many useful and relevant resources, guidance documents, policy briefs, blogs, our newsletter. So it's all on there, and we're very easily found online.
And we'd love to hear from you, because I think one great thing about our partnership is we respond to current events and issues. So for instance, in preparation for the Cape Town conference, we had a photo competition that really engaged people all over the world in terms of how they thought gender played into health systems. There was the recent consultation document led by the Global Health Workforce Alliance, and we provided comments on how to integrate gender. So we look forward to, there are always great ideas and opportunities to engage, and we really, it's through that interaction that we can affect change. So send us your ideas, and we look forward to finding ways to work together.
And as Asha said, and Rosemary, Rings is a platform. We want to engage and extend the communication and the networks that we have, so do be in touch. And Asha's talked about the Cape Town Health Systems Global Conference, and the forthcoming one in Vancouver in 2016 has a particular theme on gender equity, ethics and rights. So do think about that theme and look at the multiple resources we have on the Rings website, because there's, for example, different gender frameworks, thinking about gender and universal health coverage, gender and intersectionality, gender and M-health. So lots of resources that would help you frame and think through an abstract, and we'd really like to hear from you.
Okay. And while Rings is a health systems cross RPC partnership, the resources that are available on the Rings website have wide applicability. So I would like to encourage everyone working on gender studies or gender-related research to look up those resources, because they are definitely very useful for you.